to see my last patient. It's 11:30 and I'm almost out of here. It is 12:15. I am done with my shift at my full-time job. I work in a skilled nursing facility, which is considered inpatient. Since COVID has been up and down with the caseload, and at this new job that I'm working at, I've been here since the end of November, and they have not had a steady caseload. When I first started, from the end of November through the full month of December, we were busy, and then they got hit with COVID in January, and since then they have not been able to build the caseload back up with the amount of patients that it was getting pre-COVID. So at my new job where I'm at now, there's 2 codas including me and 1 OT. So we had to split our caseload between the OT and me and the other coda, which limit our hours down. And then in January, Medicare made changes to Med B patients. So basically they're saying if a coda sees a Med B patient, they will cut reimbursement for that patient by 15 to 20% for the coda treating that patient. So currently the OTs are seeing Med B patients only, unless something like the OT is out and they cannot get another OT in. Then they can say, okay, well, the coda can see the Med B patient, but it would have to be for an hour, well, 45 minutes to an hour, but they do prefer the OT to see the Med B patient because they do not want to lose money. So with that being said, with the lack of patients that we were getting in and us not really being able to treat Med B patient, the codas are really suffering right now at my job with the amount of hours. We are getting no more between 3 to 4 hours a day. So to make up for my lack of hours, I work PRN, and that's where I am headed now. My advice for upcoming codas is to get as many PRN jobs as possible, just to have for a backup plan. 1 minute the caseload is up and you're getting all your hours, and next minute the caseload is down. So that's where the PRN is really good to have. And yeah, so I'm just trying to give you guys a little insight into what it's like working as a coda in 2022. So I'm finished here for today. I'm about to go to my PRN. I'm scheduled 4 hours there, and this is what it's going to be like for me every day this week. I'm working PRN. Tomorrow I probably will only have 2.5 hours at my full-time job because I have another patient that is being discharged, and which sucks because I mean it's good for the patient that they were being discharged to go home or to the next level of care. We are not getting patients in to make up for the patients that you lost. It's just your caseload continue to go down. My concern right now is my insurance, because I have not been getting 30 hours a week. So I'm afraid that eventually my insurance probably would cut me because I'm not getting full-time hours. From the months between February and now, I've been getting I'm lucky to get, so the months between February and March, I was getting like 28 to 30 hours a week. And the month of April and May, so far, I've only been getting 20 to 24 hours a week. So this is my life as a coder right now. So I'll talk to you guys later. Bye-bye. It is 3:20 and I'm leaving my PRN gig. So I'm gonna have to talk to you guys while I'm driving because I have somewhere to be and I don't want to waste time just sitting here. But yeah, so I just left my PRN job. It's 3:20. I had 5 patients that all were 45-minute sessions, but 3 out of my 5 patients I had to cut the treatment time short because they were not feeling well. And then my last patient, he refused. He was doing low blood pressure and he just was not feeling well. So out of my 5 treatments, only one of the patients I saw for the full 45 minutes. And at this facility, there's a lot of COVID positive patients right now. So I don't know what changes are going to happen in the upcoming week. I'll probably be back to this PRN location next week. So yeah, I don't know what the treatment protocol would be as far as, are you gonna maybe go to the gym, or if you can only provide treatment in the room. Since I knew they had a lot of patients today that was testing positive, I just provided treatment in the room. I didn't want to take any chances. So that's how my day went. I did record a morning routine, you know, getting ready for work and going into work, but something happened to that recording. So I usually leave home at 7 o'clock and get to work by 7:30, and I usually start my treatment at 7:45. But like I mentioned earlier, my treatment time at work has been really low because of the census. It's like really low right now, so I have to work PRN to make up for my time. So I usually get work at 7:45 and just do my thing. Well, I clock in at 7:45. Luckily with inpatient, since I've been working as a code, I had not had a set time, just as long as I get my treatment sessions in for that day. So this is pretty much life as a coder for me right now. I am looking to switch in settings, switching from doing inpatient and maybe testing out maybe a home health or outpatient. I do know for home health you need at least 1 year of experience. And a home health agency actually did reach out to me about a week and a half ago, but it was only offering part-time. So that's pretty much it that I have. I can't think of anything else right now. I wish I could give you guys some more, but of course with HIPAA, can only do but so much. So that's all I have for this video, and I will see you guys soon.